Okay, this is my card. You can see the front and the back. Put it for later. Hi, my name is Kat. I'm a student from South College, and I'm going to be your student nurse today. Is that okay?
Okay.
Are you okay with me doing a head-to-toe assessment on you?
Yes.
Okay, perfect. So, for my privacy, what is your name?
Amber, Warnbeck.
What's your date of birth?
March 11th, 1994.
Where are we at?
We're at your house.
And what year is it?
2020.
Okay, perfect. Amber is alert and oriented times 3. So looking at general appearance, she is well nourished. She has the ability to hear and speak. She's understanding what I'm saying and talking back to me. Her skin is consistent with ethnicity. Her posture is well, and she is pleasant to be around. So we're going to go ahead and start. I'm going to touch your head and the other parts of your body. We're going to start on your head. Okay. Tell you where we go from there. So, any pain or tenderness?
No.
You sure? Okay, perfect. So, she is almost cephalic. Her hair is evenly distributed. Her scalp doesn't have any lesions or any dandruff. So, we're going to go to her ears next. They're symmetrical, aligned, and intact. Her eyes are symmetrical, and her nose is symmetrical along with her teeth. Her shoulders are symmetrical. So I'm just going to look first, and then we'll go into looking inside the ears. So the outside of the ears do not appear to have any lesions. There doesn't appear to be anything wrong with the skin. So we are going to go look inside of the ears. Okay, so pulled up and back because she's an adult. There's slight sebum present in both ears. There's no lesions, and the ears are pink. So I'm going to palpate her ears next. So pre-auricle, lymph nodes, any tenderness?
No.
Post-auricle?
No.
Any tenderness? Any tenderness in the back, which is your mastoid?
No.
Any tenderness in the external ear?
No.
Okay, perfect. So next we're going to go into the face. So I'm going to palpate her frontal sinuses. Any pain or tenderness?
No.
Maxillary? Any pain or tenderness?
No.
Okay. Can you wrinkle your forehead? Can you clench your eyes? Clench your teeth?
Mm.
Can you smile? Puff your cheeks? Can you stick your tongue out side to side? So her tongue is mobile. And that is cranial nerves 7 and 12 are intact. So next we're going to go to her eyes. So I want you to follow this pen light. Look at the pen light, and you're just going to move your eyes, not your head, okay?
Okay.
Then look straight ahead. So her pupils are equal, round, reactive to light, and accommodating. So I'm going to check her conjunctiva. So I'm going to pull down on your eyelids a little bit. It won't hurt.
Okay.
Okay. So her conjunctiva is pink and clear. Her sclera is white. Her cornea and iris are transparent. So we'll go to her nose next. There doesn't appear to be any lesions and symmetrical. So if you lean your head back. Okay. So the inside of her nose has clear mucosa and is pink. The septum is not deviated and is intact, so it's good. No holes or anything. Next, we're going to look inside of your mouth, and then so her lips are moist. Can you line up and move around? Okay. Can you say ah? Can you lift your tongue up? Okay, perfect. So her tongue is mobile. Her uvula is mobile. Her tonsils are +2. Her buccal mucosa is clear. Her teeth are white white and round. Her gums are healthy and pink. We're going to test your nose patency. Can you put one over? Breathe in. Breathe out. Breathe in. Breathe out. Okay, perfect. Her lips are symmetrical. Next, we're going to check her neck. So her trachea is midline. Palpate for lymph nodes.
Okay.
Any pain or tenderness?
No.
Any pain or tenderness?
No.
Can you flip your arms? No. This is auxiliary. Any pain or tenderness?
No.
Okay, perfect. So no pain or tenderness in her auxiliary lymph nodes or her cervical lymph nodes. I'm going to check your carotid pulse next.
Okay.
So one at a time. Okay. So her carotid pulse is present and strong. Next, we're going to check the range of motion of her neck. So if you look about the floor, you look at the ceiling, you look to your left, you look to your right, you put your ear to your shoulder, the other ear to your shoulder. Okay, so she has full range of motion. We're going to check your strength, so don't let me push against you. Okay, so her strength is consistent bilaterally in all fields, and her shoulders are symmetrical. Next, we're going to go into listening to your lungs and your heart. So we're going to start with your lungs, take a few breaths. There's about 18 deep breaths, and I want to just give you a break so that you're not feeling lightheaded or weak. So we'll do some breaths, and then we'll do some with the heart, and then we'll do some more breaths.
Okay.
Okay? Breathe in. Breathe out. Breathe in. Breathe out. Okay. Breathe in. Breathe out. Breathe in. Breathe out. Okay. Breathe in. Breathe out. Okay. Breathe in. Breathe out. Okay. So we're going to go to your heart next. Okay. So we're going to start on the aortic. This is the pulmonic. Erb's point. Tricuspid. Mitral. Okay. So the heart is the rhythm is strong and consistent. The rate is consistent. S1 and S2 are present, and S3 and S4 are not present, so no murmurs. With her, so I guess we're going to go back and check the lungs for the rest of them. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Okay, we're on this one. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Okay. Still doing okay?
Yes.
Okay. Breathe in. Breathe out. 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 Okay. Rotate like that. So with her lungs, their lung sounds heard in all fields. No crackles, nothing, anything abnormal. For the sake of the video, I didn't have her remove her shirt, but her skin color is consistent with ethnicity, no lesions, and Great, so we're going to check your thoracic cavity. So she is 2 to 1, so that means she has a normal thoracic cavity. So next we're going to go to your abdomen, so if you don't mind laying down. Is it okay if I pull your shirt up?
Yes.
Okay, so she, her umbilicus is midline, her stomach is flat, she doesn't appear to have any lesions, her skin is consistent with ethnicity, she does not have pulsation in her stomach or in her neck from earlier, and so we're going to listen first for vowel sounds. Okay, so she has vowel sounds in all 4 quadrants, and they are normal active. We're going to start with some palpations next. So we're going to do a light palpation down to 1 centimeter. Any pain or tenderness?
No.
And if you have any pain or tenderness. Okay. So no pain or tenderness, so we're going to go into deep palpations down to 4 centimeters. Pain or tenderness?
No.
Pain or tenderness?
No.
Pain or tenderness?
No.
Pain or tenderness?
No.
Pain or tenderness? Okay. Perfect. So her stomach is flat and soft. No mass is felt. So if you want to go ahead and come back to the chair. Okay, so you're going to touch your nose, touch my finger, quicker. Okay, perfect. Other one, same thing. As fast as you can go. Okay, perfect. You put your hands, you're going to flip them back and forth. Faster. Perfect. You take your foot down to your shin, heel down to shin. Okay, perfect. Can you close your eyes? I want you to let me know whenever you feel me touch you.
I feel it. Yeah. Feel it. 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 Feel it.
Okay, perfect. You can open your eyes, and if you'll stand up for me, please. Okay, so feet together, and my arm's right here, but I want you to close your eyes. Okay, you can open them. So that's a negative Romberg test. She didn't have any swaying. If you can bend over and touch your toes. Her trachea is midline. I meant her spine is midline. Can you lean back? Side. Side. Twist. Twist. Okay, so she has 4 range of motion. Any pain?
No.
Okay, perfect. Can you walk normal? Can you walk back on your toes? On your heels? The other way? Okay, so her ambulation is good. So that's it. I'm going to check my card. Okay. So I don't know if I said that with your eyes, your cardinal fields of gaze and the nerves that are intact are 6, 3, and 4.
Okay.
So that's it. Thank you, Amber, for letting me do this.
You're welcome.